Everyone, a very warm welcome to all of you from MedExam Expert. I'm Dr. Pradnya. I'm a mentor with MedExam Expert from almost 2 years now, and I hope you're all doing well. So let's keep this an interactive session. We're all here to meet and to talk and figure out what went wrong and how we could change ourselves. To the ones who made it, big congratulations. To the ones who couldn't make it this time, the congratulations is just a little delayed. I'm sure it's not going to be denied. All right, so do we have anyone who wants to join in and put in their inputs or want to talk or have a conversation?
Hello, yes, Dr. Bradnya, I am Iman.
Hi, Iman.
Hi, fine. Um, just I need to know because I didn't pass in November. This is the first time to go to the part 3, and it was Osler.
Okay.
And I think after the exam, when I get the result, the station was not difficult. Just one station was little bit new, but the
Okay.
13 station was I know about the information and the applied clinical knowledge. But I think I missed the structure of the task, or I missed um, the time management also for each domain. And I don't have the frame of the task, how to get all the domains in the specific time. I think this is my mistake, and also I need guidance and help, because I
Okay.
think for the information it is okay, but how to use the information in the proper way, and how to put all the domains in the proper time, I think I miss it. So I need to practice more and more
Okay, I
to
got
get
your
the
question.
frame of the task.
Correct. So what I can say, it's very simple. What's very simple about what's going wrong here. All you need to do, I think, is forget about each time. Now everyone is just following templates, isn't it? Everyone is just trying to learn templates and say it out. But if there is a scenario which is a little different from what you might have said or what your template might have been, it gets very complicated during exam, right? So I think the whole idea of revising and just repeating templates should take a back seat, and what should take a front seat is when you're practicing, you should have uh, domains in your mind, right? Whenever you're revising with your study partner, whenever you're doing stations with your seniors, or if you have a mentor, if you're doing stations with your mentor, it should be very, very, very important when you're receiving feedback. It should be a domain-wise feedback. That it has to be covered, that, oh, communication with patients and relatives, that was okay. Communication with colleagues, that was fine. Did you refer to the GP? Did you do all of that? Okay, so this domain is ticked. This is the only way. If you practice having domains in mind, if you think, oh, patient safety, these points are there and they have to be covered, only then they will come out. If you do not practice that way, if you just try to do it in each station, each topic as a station, then probably sometimes very important points like patient safety points, you might because for us they might not be important, but those are the start points in the examination. So if we tend to miss that out, they completely fail you. They even if everything else is okay, if you miss that one point, you lose the station. So well, that would be my 2 cents about it, right? Okay, man. Does somebody else have
Yes,
any?
Dr. Bradnia, can you repeat again which I will, if I miss the station? Can you repeat it again?
What I was trying to say is each time that you're practicing stations, either with your friends or with your mentors or wherever you're doing stations, it would be great if you're receiving feedback that are domain-wise. So whenever you're doing a station, for example, it should not be like, oh, this template is there and this template was ticked all the time. It should be that, oh, so patient safety, all these points were covered. For communication with patients and relatives, this points were covered. For communication with colleagues, these points were there. Information gathering, these points were there and they were covered. This is how it should be, rather than, just going from top to end like one case at a time. Okay. I hope that helps. If you still have
Yes.
any doubts, you can get in touch with me. You have my contact details. We'll talk and we'll try to figure out what exactly went wrong and which module there was a problem. So next time we can just work on those points, because other points I'm sure you're quite thorough with, right?
Yeah, thank you, Dr. Bradney. It is not the module, it is
Mhm.
the
Overall,
structure of the
yeah.
task. How to grip the structure of the task. I think this is my mistake. Yeah, yes,
I think yeah, only with practice and if you keep doing it over and over again, it should become a second nature to you, right? So information gathering, you have to ask these many questions. So only if you do it 20 times, 50 times, it will become a second nature to you and you will not forget any point. And one
yes,
thing will
okay,
come after the other thing. So yeah,
yes.
that would be me to send on it.
So
Thank you so
it
much.
needs, Dr.
Yeah.
Bradnia, so it needs time to practice and revise and revise and revise. It is not
Yes.
like I did it, that's it.
So I think it should be a very smart approach to it. Unlike part two, this exam is more about talking, right? So reading is one part of it, but keep talking. So a lot of us, our primary language is not English. So we don't speak other than, doing the stations. Overall, we tend to not speak in English or not do it. So I would suggest whoever you are talking to, be it your friends or your relatives or whoever is there, sit and talk to them and make them explain about your patients or the diagnosis, because they are laymen, and if you get your point across to them, you will be able to get it across to your role player in the exam. So even not just when you're studying, otherwise also when you're sitting having tea or coffee, when you're having a conversation, talk to them and probably explain to them what is ectopic pregnancy and tell them, oh, this is how we manage. It should come very naturally to you. That is what I'm saying. It should not be like, oh, only exams I will speak like this, rest of the times it's okay. So I hope I'm making sense.
Yes, thank you.
Yeah.
Thank, thank you.
Thank you so much.
Thank you.
All right. So does anybody else have any problems that they faced in the exam specifically, or they thought that there were some points that were lacking? Dr. Mehnaz, I can see your mic is unmute. Do you want to say something?
No, ma'am.
Okay. All right. So overall, can I ask which station did you all find difficult? Was it labor ward prioritization this time that was difficult, or which you thought you couldn't do it as much as you could have wanted?
Hello.
Hi, Atya.
Hi. In my exam, it was gynae ward. Um, that was the patients were transferred from emergency to gynae ward, and then there we have to manage them. Now there was an ruptured ectopic scenario in
Okay.
which they have told that beta HCG was some 7,000 or 8,000, and
Mm-hmm.
there was a free fluid in the pelvis,
Mm-hmm.
and the patient was admitted in pain in emergency, but now the pain has settled, and she's now okay, she's now pain free, and she was um, shifted to the ward. Now
Mm-hmm.
what should be the management? as emergency is over, but there is the root cause is still there. We need to prepare her for the laparoscopy, right?
Correct.
But
Absolutely.
the examiner was he wanted to hear something else. He was not satisfied after I told him everything, that we will
Mhm.
send the bloods, we will cross match the blood, and we will alert our anesthesia team, we will
Mhm.
make sure all the pre-op arrangements, and after that we will shift her for laparoscopy. But he
Mhm.
was not happy. I don't know what else he wanted to hear.
Was the patient in shock? Were there any signs
No,
that?
no, no. She was in pain, first of
Okay.
all, when she was admitted in the emergency. Then
Okay.
after that, after a few hours in the emergency, her
Mhm.
pain was settled, and now
Mhm.
she was shifted to back to ward.
Okay.
Now, that was four or five or six patients in the gynae ward. You have to manage just like gynae list and labor ward protocol. This was the third station, like the other two. But
Okay.
the scenario was that these patients were in ward.
Okay. Okay. So probably, so did the examiner tell you in any way that they're not happy with it?
No, he did not tell that. Obviously, he won't tell me that I'm not happy with your answer, but I can sense it that he was not satisfied.
Okay. Well, if you've ticked all points and if you answered according to the guidelines and if you've not forgotten anything, so I can't really be sure of what exactly happened in that station, because the way you're telling me, this patient does need a laparoscopic salpingectomy from whatever you're telling me, but I can't know the station exactly, isn't it? And we can't know
Yes,
what exactly they are expecting or if they're happy or not. So our job to actually sit and decipher if the examiner is happy or unhappy or answered up to their expectation. All we can do is do our best and just wait for the results. So if you answered well, I am sure it's not possible for them to not give you um, the mark. So it couldn't possibly be something like that. So I think you should just go ahead and
Hi, Dr. Pradnya. Please turn on your mic. We can't hear you.
oh, I'm so sorry. So okay. All right. I'm so sorry. Now is it better?
Yeah, no problem. We accidentally muted you, so you can carry on. Thank you.
All right, all right. Thank you so much. All right, Atya. So I was just saying, if you've done a good job, it's not really possible for us to actually sit and judge how they are judging us. So let's not go there. Let's just stay at our end and prepare the best that we can. And regarding structured discussions, I think it tests our applied clinical knowledge way more than any other station does. So it's very important for us to be absolutely thorough with the guidelines and with the concepts and answer in a way that the examiner is expecting, that the examiner's key has. Okay. Oh, sir is here. Hello, Hassan sir. Welcome to the session.
Yeah, good evening. Good evening, Dr. Bania. How are you?
I'm good, sir. How are you?
I'm fine, thank you. Good evening, all friends in the room together today. I don't know, I can see many names, people Some of them attended the exam, others are waiting for the trial in May or in February. So I will try to, number one, talk generally regarding the results of November exam, okay? So I think you, Brady, started the session around 20 minutes ago, am I right?
Yes, sir. Yes, sir, waiting for you.
So yes, number one, I would like to say for people who could not achieve success in November exam, it's not about pass or fail. It's not like this, okay? It's about a competition and whom will be able to achieve the needed standard. So if you are not able to achieve the standard, it doesn't mean that you are failed in the exam. It only means that you have somehow to improve your skills. So it's a game. It's like a marathon. They will take the best 20%. If you are a 21% from the 21%, it doesn't mean that you are a bad guy or you are a bad candidate. It's not like this. Exactly like part two. Now, why people most probably suffering in part three MRCOG, despite 100% their knowledge is very good. Why? Because the exam in part 3 MRCOG, we are not concerned about knowledge too much. We are, yeah, this is Bradnia, one of the most critical pitfalls. The candidates are going for the exam, starting the station, trying to talk too much and to give a lot of knowledge, okay? This is critically a big mistake because simply, we are not looking for this. We are looking for communication skills. We are looking for paramedical issues, okay? Paramedical issues. Hello? Am I audible?
Yes, sir. Yes, you're audible.
Yeah,
Yes,
we
you are
are
audible.
looking,
Yes, sir. Yes,
yeah,
sir.
we are looking for paramedical issues. If you have a situation with a, you know, a patient after laparoscopy, she came back with fever, distended abdomen, loss of intestinal sounds, and picture of peritonitis, then this is a bowel injury. Now, the non-competent candidate will answer like this: I will call for help, I will reopen the patient, I will correct the bowel injury by using 2-0 Vicryl, continuous suture, I will check there is no leakage, I will put a drain. Okay, all of these stuff are fine. But if you missed duty of candor, incident report, risk management team involvement, GP letter, high dependency unit admission, and all of paramedical staff, you will fail. I will never give you marks for the knowledge alone. It will not be like this, okay? And you can compare this answer and this attitude to all stations. If you have, I found a candidate, I mean, many candidates in exam, they are acting like this. The patient said, I lost my baby in previous pregnancy because I had a severe bleeding. Okay, I'm sorry. So tell me, do you have any other medical disorders? Now, is this the appropriate, empathetic approach to manage the patient? It's never like this. Don't be a robot. Don't be machinery acting like, okay? This is extremely important. The people in the exam could not understand what is going on with this exam. This exam is to assess all things except knowledge. 20% of the exam is knowledge. Just 20% of the mark, okay? one of the most important things as well regarding the evaluation. Now, I believe, starting from the past exam, November exam, the policy of the college is changed. I believe in that. I saw in Egypt, the exam was a live exam, face to face. So I have a chance to see many other stations than my station. So I take a look on the marking sheet. The marking sheets are extremely sophisticated. I believe in that. Okay, they are really difficult. Now the marking sheet is not like previous exams. So I think the policy of the college is changed regarding the standards of evaluation. And if candidates and mentors are not able to modify their practice, the path will be extremely difficult. Okay, I will give you a very simple example. A patient, ectopic pregnancy. Okay, ectopic pregnancy. Now, how to manage ectopic pregnancy, breaking bad news, options like self-injectomy, self-angiospermy, blah, blah, blah. It's okay. In previous exam, it was like the patient is Rh positive, no problems. Now, in the same scenario will come again in the next exam. People who are depending on memorizing recalls, I know this station. People asked about Rh and she was positive, so no problems about the Rh. Now, in the new marking sheet, they changed the scenario to be Rh negative with history of previous hydrops baby. Now the scenario is completely changed. Despite the original scenario is the same, but they changed only a very small part in the patient scenario and the role player scenario. So your answer dramatically will be changed. Okay? This is the game they are playing right now. They are taking the recalls and changing some important hidden points regarding the marking sheet. So if you are depending on remember the recalls, you will 100% fail. So my advice is try to understand rather than memorizing information. Try to reformat your brain. If I have a scenario which the patient is at high risk of bleeding or in bleeding, I will automatically check for blood transfusion availability. This is automatic in my brain, okay? Because I understand the situation. But it's extremely unlogic to ask about blood transfusion rejections or objections if the patient is very calm. Simply, she will tell you, sorry, doctor, why you are asking this question? I'm in a serious condition. Now you have to explain to her, no, you are not in the serious condition. I asked this question because all my colleagues asking the same question for irrelevant reasons. I'm sorry. It's extremely unlogic, okay? And I'm telling you some important tips from behind the scene, okay? Examiners after, and maybe Bradley, I know this, you know, after the exam is finished, after the day is finished, we have examiners briefing session. So we are all set together to evaluate the candidates and giving feedbacks about the scenario itself, if we have to change anything in the scenario and so on. So, you know, the most common comment by all examiners I have been examining for the last 2 years, so I am I examined for 6 batches of the exam. Okay, and yeah, I think thanks God. Last week I had a permission for being approved permanent examiner in the RCOG exams. Alhamdulillah. So what I would like to say is the most common comment by all examiners is, I saw 28 candidates copy paste robots. They are acting similarly to each other. They are following templates rather than try to think. They are asking questions in information gathering which are irrelevant to the scenario. They are asking even the question in the same sequence. I will start by asking about the complaint, medical, surgical, family, support at home, blood transfusion. Why you are asking support at home in all stations? This is unlogic. Why you are asking about recreational drugs in all stations? This is unlogic. Do you have any sign that you need to ask about recreational drugs? How it's possible to ask about recreational drugs to a woman 60 or 70 years old with ovarian mass cancer patient? If she is a drug addict, she will never reach 70 years old. She will die earlier. Okay. Why you are asking about family history in a patient with stress urinary incontinence? Is the stress urinary incontinence is inherited disease? So why you are asking about family history? All of these stuff is considered irrelevant, and these stuff annoying examiners too much. So I will give you borderline in information gathering because you asked everything. Why? I asked about everything. I catched all important points. Yes, but because you asked everything, I will translate this like the candidate is not able to identify the relevant points. He asked everything because he is not competent enough to choose and select relevant points. So I will give you borderline in information gathering. After revision of the exam, the whole candidates, I discovered that most of candidates, 70% of candidates, all of them have information gathering borderline. No one can be able to achieve success or pass. Why? Because of this mistake. So this is my third advice. Don't follow the templates. Try to build up your own mindset. If I am in urogyne or pelvic floor scenario, I have to be very relevant to the points like analysis of complaint, any other symptoms related to the urinary problems like bowel problems, sexual problems. What about the menopausal status? Is she menopausal or not? Yes, it's very important point. Now, if she is not menopausal, she is still premenopausal, what are the fertility wishes? It's very important. If she is menopausal, what about the HRT? Did she receive any HRT treatment? Okay. And what about the PMI? What about the social habits? Like cafe, it's not in this station. Social habits is not recreational drugs. Okay. It's about alcohol, caffeinated drinks, how much fluids. Do you have any exercises, activities? These are the social points in this scenario particularly. This is what is meant by relevant points. Okay. So These are all questions needed to be asked for in urogyne. Patient with SUI, why you are asking about her supporting home? Why? I will ask about supporting home in urogyne if the patient is coming to complain from incontinence, pain, suprapubic pain for no reason. There is no reason, no obvious scenario. She, for example, has no children, no vaginal deliveries. She's fit and well. She's okay, not drinking, not a smoker, and she's doing regular exercise. So there is no reason. I can't find anything. So I may check for support at home. I may think about domestic violence or other issues. Otherwise, it's not a routine question. Okay, it's not a routine question. So again, this is critically important to start building up from now your own character, your own personality. Okay. Bradney, are you still with me? I'm talkative too much. I'm talking too much.
I'm right here, sir. No, you're not talking at all. Right here.
Yes, because you have to
This is
stop
very
me at some
important,
point,
Tom.
because once I start talking, I will never stop talking. So this is my
But
problem.
but your inputs are so essential, because how else would we hear what an examiner has to say? You've examined so many students. We only know our side of the exam point, the one exam that we give, but you actually have been seeing so
Yeah,
many
yes.
students. Your inputs
Thank
are
you.
vital.
Yeah. So yes, exactly. So the last advice, the rapid advice is um, in this exam, in simulated patient task, try to listen more than talk. Active listening is too much appreciated action, rather than keep talking, and then giving the role player a chance to express her concerns or to negotiate with you. In structured discussions, do whatever you want. You can talk rapidly, you keep talking all through the 10 minutes, it's accepted. But in simulated patient task, always give a chance to the role player to express more and more. And always keep the discussion. This is one of the most common pitfalls as well. Always keep the discussion open. There is no need to give a final decision in any station. Even in structured discussions, people are, when the examiner asks you, so what is your diagnosis, for example, people are answering like, my diagnosis, this is whatever the diagnosis is, any diagnosis, a certain diagnosis. No, the best answer is to keep the discussion open. So differential diagnosis is 1, 2, 3, 4 options. Most probably, according to the scenario and given information, it is X. It's X, Y, Z, W, but most probably it's X. So even if your choice is wrong, the examiner has a chance to help you and to, direct you towards a certain diagnosis. But if you are too much confident and giving one option, and if it's wrong option, the station is finished, unfortunately. So what does that mean? It means keep the discussion open. Don't give sharp answers. Always give differential diagnosis, different options of management, further appointment, involve your consultant, give PILs, and ask the woman to revise her mind if the situation is not an urgent case. Okay. In this exam, training is very important. I received a lot of messages after the results, as usual, People are so much disappointed because they said, we did a very, very hard working and too much effort to pass this exam. Now, this is not a point that is, it's not a shame that you did a lot of hard working and you could not achieve pass, because all people attending for the exam, they did a very hard job, okay, a very good job. But the game is, smart working is completely different than hard working. Don't do hard working, try to smartly working. This is very important. And how to do this, you have to understand what are we looking for. For those people who are not passing the exam, I can understand your feeling very well, because I passed through the same experience, by the way. All of us passed through the same experience of failure or not getting the pass mark. In the first trial of my trial, I didn't have a lot of time to prepare well. It was the first exam in the new format in 2016. And the exam was 1 month only after the results of part 2. So I went through the exam. I was pretty strong in knowledge. So I give a lot of knowledge. There is no mistakes ever, okay? I passed in information gathering, passed in applied knowledge. I failed in communication skills. Okay. Then in the second trial, I asked some people, what should I do? They said, try to be, very sensitive with the role players and in your communication. Let the knowledge away, subside the knowledge. So I went to the exam. I was very sensitive, like, an artist or something like this. And then the results came back. I passed communication, passed information gathering, and then I failed in applied knowledge. So the game is how to hold the stick from the middle. You have to give some information, applied knowledge, in the same way you have to show some communication skills, and you have to be relevant in information gathering and keep all domains balanced as much as you can. And this is the training. How can you do that? This is by training and by experience. So, by the way, I failed twice for 1%. Twice. The first time I failed, the pass mark was 69 or 68. I had 67. The second time the pass mark was 64. I had 63. Okay. The last time when I caught this idea, the pass mark was 62. I had 78. Okay. This is the game. If you can understand the principles, you will pass smoothly. Now, the last thing, don't ever, never being disappointed or losing hope. You will pass the exam. I have no doubt of that, because nobody reached the part 3 exam and then skipped the journey for any reasons. It's a matter of time. But when the time is coming and your chance of success is this time, you will feel that, and you will say, yes, I didn't deserve to pass in previous trials. because I was not good. Okay? When you pass the exam, you will say this sentence, and remember me. You will know very well what are the differences between your level when you pass and your level when you could not pass. So it's not like, and my advice as well, I had been asked this question many times. People who didn't pass in the November, they are thinking to join February exam. My advice, don't do that. Even if there are some available seats here and there, don't do that. Take a deep breath, take some rest, mental rest, relieve the stresses, prepare well for May exam. Okay? When I failed twice, I skipped one exam and I joined the third one. Okay, so I failed in November. In May, I bypassed November and I passed in May. Why? Because I felt that I'm not understanding the situation well. I'm not able to pass through the same stresses again. I need to take a rest. So take your time. And if you are looking for repeating the exam as soon as possible, prepare for May. And from now, December to the end of January, don't do anything. Just spend time with family, enjoy your time, relax, and start again February, March, April. 3 months is more than enough to be ready for the next trial. This is very important. And again, it's very important to optimize your training. So try to find a suitable study buddy, and preferably to join as well with someone who passed the exam, and you can ask him or her how can they being able to do this. They will give you the tricks. Okay, they will give you the tricks. This is extremely important. Okay, so I'm here for questions. Anybody would like to ask about anything? Any strange thing you heard, or it's not clear for you? I will be happy to explain it right now. So whom will take the choice?
Sir,
Anyone?
Sir, I'm Dr. Shaheen.
Hello, yeah.
Hi. I just want to ask regarding this Osler exam. Should we tell the examination, I will examine you after the history, or should I not tell? This is the biggest mystery for me. In Osler.
In Osler system, in face-to-face, you know, in whatever the type of the exam is, examination is not related to the exam. Examination is a part of clinical basic work. So you have to, I explained it before. Let me ask you a question, Shaheen. In face-to-face, you are offering examination, am I right?
Yeah.
So do you examine the patient really? She's
No.
in front of you. She's in front of you. Why you didn't examine her? Because this is not a part of this exam. But you have to mention examination. Exactly like the Osler system. You have to mention examination, but don't stop at this point, and don't stress too much on this point. For example, thank you so much for sharing this information with me. Now, what we will do is, I need to examine you in presence of chaperone, and then we will request some tests and asking for some imagings as well, or scans. It's like this exactly, but you have to mention this. It's a part of basic work. So mention it, don't miss it.
Okay, okay.
But yeah, I mean, don't give the role player a time to say, how can you examine me? Because most of candidates are afraid from the,
Yeah.
it happened once before, and it was a mistake from the role player. Yeah, you have to
Okay.
understand this. It was a
Okay.
mistake, and the role player was revised, and not in, it's not a regular act, it's a sporadic act.
Okay. Okay.
Yeah, thank you. Sarah,
Okay.
I
Thank
think
you.
you would like to ask about something. Yes.
Yes, sir. I'm Dr. Sara. First of all, I really appreciate and I'm thankful for your comments because they were really valuable. Whatever you are telling us right now, I was really feeling like each and everything was 100% true. That was the thing that I personally felt in my exam. Like the question, how support at home, when we were asking those questions, I was feeling like the role player was getting irritated. Like these are the not important question. So it
This
was
is what I'm
completely
trying to say.
irrelevant. I
You,
completely agree. This was the thing like that.
thank
Exactly.
you so much for supporting my opinion. you know, this is my problem.
Yes,
I'm
sir. And
trying to tell
related to this,
people,
I had a question. Yes, sir.
I'm trying to tell people that, I'm trying to tell people that it is not important to check irrelevant points. I will tell you a very simple example. I had a station in the exam about antenatal bipolar depression um, and postpartum psychosis, SD station. It's extremely difficult, by the way. Okay. And then people, one of the questions are, what are the important points in history you would like to ask for? Okay. 28
Yeah.
candidates, one candidate game pass. All of them failed versus borderline. Why? They ask it, just a second, please. Yeah, just a second. Sorry, I'm back. So what I tell you the secret. People asked about everything, everything. But the asterisk point was in history of contraception. History of contraception. Why? Simply, if you have any case with medical disorders with pregnancy, it could be epilepsy, diabetes, uh, um, um, psychological disorder, whatever the disease is. You simply have to ask the woman at the beginning, is it a planned pregnancy or not? Most of candidates miss this
Yeah.
because if the pregnancy is planned, it means number one, the woman attended regularly the pre-pregnancy counseling clinic, so most probably she is controlled. Number one. Number two, planned pregnancy or unplanned pregnancy may change the scenario in management completely. So if it's an unplanned pregnancy and she is at high risk, her health or her baby's health, I can offer termination. But it will be completely unlogic to offer termination as a primary option in management if the patient is looking for this pregnancy and wanting this pregnancy. So number three, if it's a planned pregnancy, it means the woman was not on regular contraception. So one question, one relevant question will cover three important parts. And all of people miss this question. And of course, they will gain borderline. Now, it's completely different to ask relevant questions, important questions, and to ask rubbish questions. Okay? Because most of candidates, Sarah, are,
Yeah.
are following each other's. You will ask like this in all stations. All of us did that. Now, it's not like this. Previously, in previous old patches, yes, maybe the judgment was by ticking points. If the candidate asked about this in information gathering, I will give him the mark. But this method or this way in judgment is changed because it's unfair to give pass to all people in information gathering to whom are able to catch the relevant points equally to whom are not able to catch the relevant points. Of course, people who can realize the relevant points are smarter and more standardized than others. You understand me? So the judgment is different. And I saw many in some of exams. I'm not an examiner in any station, certain station. I'm an observer-led examiner. So I'm moving between the rooms. I'm moving between the rooms to see the performance of examiners, candidates, role players, lay examiners. So I understand very well what you talked about. The role players sometimes have no answer to this question about support at home because it is not in their scenarios, because it's not relevant point. You understand me? So sometimes people are asking questions.
So many things.
Yes, people are asking questions which are not relevant and even not in the role player scenario. So they are not able to answer. They somehow being confused or estranged. Okay. So it's very important thing to choose your questions. Thank you, Sarah. Finally, I found somebody to agree with me because people are
Thank you,
not
sir.
leaving.
Sir, I personally felt it. I had one question, sir, related to my exam. As we were clearly following the templates, this is what I felt. So we were guided, like whenever we see a patient in front of us, if she's having pain, so first we have to offer her pain relief. Then the template we were following, like should I offer you some, if as I can see you are in pain, the role here says they're comfortable now, then we continue. But this doesn't happen with me. When I saw she was in pain, I said, should I offer you some pain relief? She said, yes, I'm in great pain. I said, okay, I will ask the nurse to give you some pain relief. After a few seconds, I asked her, are you okay now? She just made me feel like nothing has happened. No one came and has given her anything. She said, no, I still have pain. Then I was shocked at that time, like, what should I say? So how could I
because
have tackled
because
that station, sir?
because simply, this is what I'm always saying. Don't be fake. Don't be overacting. Okay. For people who are asking about examination, okay, for people who are asking about may I offer examination in Osler system, why you offer painkiller in Osler system? It's as same as examination. So this is one of the points, important points as well. But back to your question, it's very important to avoid this problem. You have to ask the patient, are you in pain? I'm sorry for that. Are you able to carry out this appointment? Don't offer her painkillers or blah, 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 or this stuff. Okay? Don't offer her this. Number one, this is a very medical mistake. Very important medical mistake. Patient in pain should not be offered painkillers because the painkillers will masking the pain. So this is a medical mistake. Number one, I'm giving the patient maybe antispasmodics or something like this, but not a painkiller. This is number one. Number two, if you would like to offer painkillers, you have to say after exclusion of allergies, because there are some patients with allergies to non-steroidals. If you miss this, I will give you a negative point in patient safety. So you will lose marks. Number 3, it's not logic that every single patient in pain, in clinic, in real practice, I will offer her painkiller first. So how can you avoid problems in this situation? Simply you can say, are you able to carry out this discussion? She will say, yes, I'm in pain, but okay. Because she had to continue the station. Now the problem is finished. You can keep asking questions and moving in the station easily.
Yes.
Easily.
Hello, sir. Good evening. Dr. Zaid
Hello,
here.
Dr.
How are
Zaid.
you?
I was waiting
How
for
are
you.
you? Yes, yes, yes. I'm sorry I was in hospital. I just came back. So I just
Yeah.
want to add one thing in this pain point. The thing is,
Yes.
I know, I'm sure you are also familiar with this. I am also familiar with this, and many of the candidates as well. So we will always try to offer them pain relief. Once if you see that patient is like, kind of panting, patient is like, unable to talk, patient is not, able to talk or finish any sentence as well. This has happened to me. Okay, when I was in my exam, this happened to me as well once. She was in so much of pain, and so like Dr. Hassan said that, okay, we can simply ask that, are you able to talk? Are you good to talk to me, or do you need any kind of the pain relief? In that scenario, you are going to ask. There is no hard and fast rule to follow template. This is what me and Dr. Hassan been telling and coaching each and everyone whoever comes to us, and even in our the open discussion sessions as well. So please, 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 guys, don't follow your 2 pages, 3 pages template for everything. Like Dr. Hassan, I still remember Dr. Hassan always say, patient is 80 years and you are bothered about, can you pardon me asking about recreational drugs. What is the role of 80 years and pardon me asking drugs, at that time? So we have to formulate our history, we have to formulate our questions according to the nature of question, not according to what we have fixed in our mind or what we have been taught and what we have been reading throughout. Okay, so for the
Yeah,
pain,
another point.
always.
Yeah.
Yes, sir. Yes.
Another point, Dr. Zaid, regarding this issue. People are, they are trying to act, but in a very bad way. Okay.
Exactly.
They are trying to act in a fake way. Always I noticed that overseas candidates, keep your eyes on this. Compare the UK trainee to overseas candidates. Overseas are always signposting before asking any question. Now it's really, it's really strange to listen to a candidate. She's saying, I'm really sorry, I will ask you a very sensitive question or a rude question. Do you have a partner? Now the role player is looking to her like, what are you trying to say? Is it a shame to have a partner? Is it a sensitive question to ask about this? Never. No. Even asking about shared infections. Okay, it's like an infection, like pneumonia, like sinusitis. It's an infection. There is no need to signpost before every single question. This is really annoying examiners, really. Okay, and you know that it gives a very negative point that this candidate, this candidate never been in UK and never understanding how can he manage or she manage the patient.
Really wants to be more extra polite and sugar coated and just like be the mummies and daddies. Oh, come on, they're not expecting us mummies or daddies. Okay, they are expecting us as a normal doctor, what we are behaving, how we are behaving. So I have seen candidates I have seen candidates performing like this. Oh, I'm so sorry, I can feel your pain. No, nobody can feel anyone's pain. I'm sorry. Okay,
yes,
I'm
this
in
is not
pain.
a
Can you feel my
professionalism
pain?
act. This is not a professional act. It's exactly like the difference between sympathy and empathy.
Empathy, exactly.
Empathy is important, but sympathy, if the patient is crying, I will never cry with her.
Exactly.
This is not a professional act. Okay, don't try to be so much decent, because you have to be formal, you have to be professional. and act
And
appropriately.
and don't fake things, please. Don't fake things. Whatever you are, whatever you do in your day to day, the basis for your own patients, just act, accordingly in the real exam as well. Nobody is going to ask you to sit in the foot of patients and, just talk to them that, okay, oh, I'm so sorry, this has happened to you. I'm so sorry, I can feel your pain. Oh, please
Yes.
don't do that. Don't do that.
and please try to change this sentence.
Hmm,
Don't say about
exactly.
everything I'm sorry. Why you are sorry?
Exactly.
Why? It's abnormal sentence. Everything you are
Hmm,
sorry. You can
hmm,
change this
hmm,
sentence to be more natural. Like, yeah,
hmm.
I got this point. Or yes, of course, I can understand this. Okay?
Sir, we can say
Rather
like
than
this.
saying I'm sorry, I'm sorry, I'm sorry.
Yes, you can simply say, I understand. It must be quite painful you are going through. I'm so sorry that you have been through this. Simply like this. Only once is okay. Saying sorry again and again means it is your mistake. You have caused something. Until and unless there is any kind of medical negligence, until and unless there is something, you are facing any angry relative, angry patient, or angry, the husband for something, to which you have to say, once or twice sorry. That makes sense. But not in
You know,
everything. That patient is having pain, so I'm so sorry you are having pain. I'm having vomiting,
even
I'm so sorry that you are
mhm.
having vomiting. Yes.
Even in duty of candor, if you have a complicated case by medical team problem, they always recommend to apologize once. That's it.
Yes.
One time apology, and then keep head nodding, accept the patient's angerness, and so on. But don't repeat, we are sorry, I'm sorry. Yeah,
Exactly.
because it's now you are incriminating yourself by indirect way and incriminating your team. Okay, so
Exactly.
keep this in your mind. Overseas candidates have some problems to manage away from the UK trainees. UK trainees, by the way, are very rude. Imagine that.
They are.
They are, they
They
are
are. I
asking
have faced an
questions
exam. Yes.
aggressively. Okay,
Hmm.
so
Hmm.
do you have any infections, shared infections or sexual infections before? Okay, this is the
Hmm.
question without signposting. Okay, because this
Hmm.
is a normal thing regarding their traditions, their background culture. But
Hmm.
because of our background culture, sometimes religious backgrounds and cultural traditions, we
Hmm.
are dealing very sensitively with sexual issues. Okay,
Exactly.
I'm always saying that. So these minor mistakes. Now let's be so frank. So frank. I'm always saying
Hello,
this.
Dr.
One of the
Hassan.
Hello, Dr. Osma. How are you?
Hi,
Fine,
Dr.
thank you,
Usma.
doctor. Hello, assalamu alaikum, everyone.
Walaikum
Sorry, I'm
assalam.
disturbing you. Actually, I just joined in between my session.
Yes, take your time. Take the mic. Take the mic
No.
until, tell our experience, your experience, and then we will continue with Dr. Zaid. Please take the mic.
Yes,
Yeah,
sir.
I'm sorry, really, guys. Actually, you see, the thing is, one of all, don't lose your heart. Passing or failing exam is just part of the game. And appearing again only adds to your knowledge. So there is nothing wrong or no sin you committed after failing the exam. Once you are a MRCOG, you are a MRCOG. Whether you pass with 90% marks or you pass in fourth attempt, nobody will dig into that, okay? So just
Hmm.
stay
Yes.
focused, continue working hard, and eventually you will be there where you want to be. It is just not something life goes on. It is not death which happened. So just continue working hard, stay focused. And as doctor said, never said that I can feel your pain or I know how you're suffering. No, you just see
Hmm.
the word that okay, I can see that
Understandable.
you are unhappy, or I can see you are in pain. I'm sorry you have to go through this. Okay, because otherwise they will say, okay, somebody is saying I have this incontinence, I can understand, so you also have incontinence. No, it doesn't go like this. Okay, the other thing is, whatever course you people are taking, please attend the sessions, participate actively. That will
Hmm.
remove the hesitance of speaking in you. Once that hesitance is gone, you will be confident, and you will be able to communicate properly with the patient. You will
very
identify your
important.
mistakes.
Very
Very, very
important.
important.
Very important, Dr. Uzma. Thank you for this point. Very important. People
Yes.
are paying for courses and they are hiding away from the attending the live sessions. And even if they are attending the live sessions, they are somehow shy to participate in front of people. You have to normally act, okay? You have to do it many times to improve your skills. Thank you, Dr. Uzma. Actually, very valid point.
Yeah, because we took a course, hardly anybody want to attend the course. If you are attending the session, then you don't want to speak. So how are we going to help you, and how you will help yourself? You cannot improve by listening to others. You have to perform. You have to speak. In the exam is final, but in the course, it's just a course. Whatever way you perform, just don't be shy. Just perform. Only after performing again and again, you will improve. Everybody improves. We are not something from the sky that we appeared and we passed. We also, followed the same path, and we
We have
reached our
worked so hard.
destination.
I still remember Dr. Usman
I
Sarasan.
yeah, I
We have
remember
worked
I
so
remembered
hard.
I remembered a very funny situation. I was in UK and I attended a course, a live course. Okay, so I was so much afraid from labor word characterization. Okay, and then they offered a station of labor word and asking who would like to participate. And then I, sliding under the chair, like tying my shoes or something to be away from the examiner or the trainer eyes. And then he saw me and he said, you there under the chair, come here to do the labor word prioritization in front of people. now
Dr. Hassan, I was the other way around. Even if I don't know anything, I will raise my hand. Okay, I will volunteer. And then 30 people will comment on me. You did this bad, you did this wrong. I'm okay, no problem. I'm open to all type of this discussion.
I was suffering from the same problem of all candidates. I would like to hide to keep my image. I don't like to do mistakes. He said, here, you there under the chair, come here to do the labor word prioritization. Now, I think the labor word prioritization is one of the easiest station and guaranteed station to pass. Okay, if you understand how to manage, everything will be easy. If you keep yourself away and afraid from participation, you will never pass. Never. Okay.
Yeah, correct. I think from my side, that is all. I will just continue with my session, and don't be, sad. Your time will also come, inshallah, very, very soon. Wish you all the best, and we are available to guide you, help you anytime anybody wants. Thank you very much, and thank you, Dr. Hassan and Zaib and everyone.
Thank you, Dr. Osma. Thank you so much.
Thank you, doctor.
Thank you.
Okay, back, Dr. Zaib, the mic with you.
No, thank you. I just wanted to add one thing. Like Dr. Usma said that, attend the courses if you are part of any. Second thing I want to address, which is very important. Please don't follow templates. Please don't follow the keys, any of the mentor is telling you. Okay. And please don't memorize lines. You yourself are unique. Me, myself, I'm myself. The way I speak is completely different from the way Dr. Hassan speaks. Okay, everybody has the different the kind of good part in communication and something the very unique in communication. Try to dig out on yourself. Try to use that communication skills, please. Okay. Sometimes it feels very irritating when almost every candidate is speaking the same line. And can you just imagine that how it will feel in real exam to real examiner? Me, Dr. Hassan, we both can feel that pain, okay, because we both are examiners, okay. So trust me, it feels so bad, when every candidate is uttering, the same line, same words. Please try to be innovative. Try to be yourself. Try to be natural, okay. Don't just, the simply memorize lines, and don't just simply, the behave in the lines of what is cooking in your head. Follow the role player. Okay, remember in real exam, even in this after November exam, I have heard from so many candidates that ma'am, it was very repeated exam. We have had the similar questions from the May exam and the last November exam. No, maybe questions may be same, but examiner markings, keys, and the passing criteria is going to be very different. RCOG is not stupid. They are running a very
This is what I try to explain to them before you are coming.
Oh
Exactly.
wow, wow. Yes.
I can give you the same scenario with 10 different marking sheets.
Exactly, 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 exactly. That's what I'm saying. The candidates are very happy that, oh, I have performed this station with somebody, I have done this station, and now, I'm 100% confident that I'm going to pass. Okay. Trust me, there is going to be something, the different in the keys. What is your, the role as a candidate? Your role as a candidate is prepare yourself properly. Don't just think in one blind way what you have been taught or what you have been told, okay, by anyone. Try to look at the station by all angles, that what if role player asks me this, if any role, like, I mean, we are practicing with my candidates. So if I sometimes give any kind of you can say the twist to the station, and if I ask any completely straight, the station the question, so in between, the candidates, they just get, kind of confused that, oh, how am I going to, answer for this question? Because I have not memorized this. All of you, my dear, please don't memorize questions. Do try to follow how the exam is going to be, okay? All domains, how you are going to dig out that what exactly could be the good, the scoring point in this. Always remember that you have to complete the loop. You don't have ages to finish one station. You just have 10 minutes to finish the station. Train yourself to take history in 4 to 5 minutes. Then in another 4 minutes, try to do the management or whatever you want to do. Okay. In terms of management again, for example, if it is an oncology station, urogynecology station, or any of the station, RCOG is not expecting urogynecologist in exam. RCOG is not expecting oncologist in exam. RCOG is expecting mere specialty trainees in exam who really want to, triage the patient, who really want to give first-hand knowledge to the patients, and then, they are going to send back to respective specialties or specialist or whatever. Don't just try to be oncologist in exam that, okay, I will do this, I will do. Refrain saying I so at so many places, okay? You can simply say, we are going to do this, we can do this, okay? I'll put you in touch with my consultant, I will put you in touch with this, okay? Don't unnecessarily, the use, you can say the I all the time, that I'm going to do this, I'm going to do this, because you are not only one who is going to deal with this patient, okay? I hope it is clear, because it is very important to, understand this part of the exam. Is it clear?
Zaid, it's a very important thing for all candidates to remember this fact.
Exactly.
The station is fashioned to be finished in 10 minutes. Okay. Actually, nobody can see and evaluate a patient properly from full aspects in 10 minutes. Am I right?
100%.
Even in NHS, every patient have 30 minutes average with the consultant visit. Okay, 30 minutes. So if I am looking for the candidate to finish the station or the scenario in 10 minutes, it means I need from him a very limited actions, very targeted actions, very precise actions towards this station. This is why people are saying the station is too long, or I could not finish the station in 10 minutes, because you are acting in a wrong way. You are trying to perform like in 30 minutes, just in 10 minutes. Actually, competent candidates, I saw them, a lot of them, competent candidates can finish the station in 8 minutes. I swear, in the last exam in Egypt, I had a Sudanese candidate. My station was a labor word characterization, by the way, and it was too long, 10 rooms. Okay, he read the instructions in 2 minutes and get inside the cubicle. He said, I need more time, sir, to read this station. I said, okay, take your time. 1 minute passed, 2 minutes passed. I said, this guy will never be able to finish the station, okay? Impossible. And I started to mark him, okay? I'm ready. And then after 3 minutes of silence, he started to talk. He is the only one to gain pass, full straightforward pass, 4 domains in this station that day. He finished everything in 6 minutes and spent 1 minute smiling for me. I swear, which is impossible by all means. But what he did exactly is he trying to think rather than just repeat talking like any other candidate. And he catches the most important points by concentrating in reading. And then he started talking. In 6 minutes, he finished everything. He was an amazing guy. Amazing. I never saw something like this before. Okay. So what is the lesson? The lesson is 7-8 minutes are more than enough to finish any station if you are competent enough to understand the clue behind the station and to apply some important rules in your mind, not a template, a rule. Okay, if I have a patient with high risk bleeding, I will check blood transfusion. If the patient in premenopausal age and she had irregular bleeding, I have to check first pregnancy test, preoperative pregnancy test. I will check consent. These rules are fixed. They are not templates. Okay, templates are mainly used for information gathering and applied knowledge. Okay, so this is most important pitfalls, I think, that most of candidates who are not able to pass the exam are falling in. I think so. Would you like to add anything else, Zaid?
No, no, no. I'm, 100% agree with you, because me myself has, the labor board twice as an examiner. So I really was surprised when, the few of the candidates were so good in doing, the station in good, 7 to 8 minutes. They literally prioritized properly, and then they have done everything. They have managed emergency and everything, and it all depends on that how you see. What I have felt so far with many of the candidates is they get upset when they see any kind of OT list, when they see any prioritization, when they see any structured discussion. They become upset because they have trained themselves into hello, how are you, how do you do, any all these kind of communication skills, the
Yes.
scenario. They get very
Yes.
upset when they see structured discussion. So it should not be like this. Structured discussions are equally important because they carry the equal marks. And trust me, two of my very dear candidates in November exam, they flunked with the very close margin. Okay, 62 is passed, and one scored 58, the other scored 57. Okay, and I was literally so upset by seeing their result because I had this hunch that they will pass, but somehow
Zaid,
they did
Zaid,
not.
I have 2 dear friends. They gained 61%.
Oh my God, it's me.
You cannot
Oh,
imagine how much they are disappointed, as well as me, because
I
I know
know.
this experience. I failed before for 1%. So, if I failed, I gained 22%, for example, I will be very happy. I will never be sad. But 61 is extremely, or 60% or whatever, very near mark is extremely painful. I know that.
Exactly,
Extremely
exactly.
painful. So
So when I
we need,
analyzed result with them, so I found that they did not do good in structured discussion. So please pay equal attention to structured discussion, all of you, please.
yes,
Yes.
yes, I agree. Structured discussions, I'm always saying it's more difficult than, of course, SPTs. Because in SPTs, if I don't know anything about the case or the topic, I will go to ask open questions and let the patient talk, and then I will collect information from here and there, and I will build up a plan of treatment anyway. But in structured discussions, if you are not familiar with the topic and you have no alternatives to pass the exam in your mind, okay, it will be extremely horrible. Results will be extremely horrible. So this is why SDs, even in our practice, in our courses, we are stressing more and more regarding the SDs nowadays, okay, because
In
they are
fact, candidates don't feel good if we give them SD. Have you noticed? They feel that, the Dr. Zaib is not giving us a simulated patient task and she is giving us structured decision task.
I
don't know
pass through the
why.
same experience. Why we are doing too much SDs? Because you will fail in the exam because SDs, not because
SD.
SPTs.
Exactly. So candidates really need to learn this, that you have to focus properly on structured discussion. You have to properly the focus on your communication skills. Don't just think that this is just only hello, how are you, and blah blah blah, how would you like to be called, as addressed as. It's not going to be like this, okay? So please revise your stuff. The candidates who are going for February exam, revise your stuff, and the candidates who could not make, doesn't matter, okay? It's not the end of the world. It really feels the bad. We have been through this. Me and Sir Hassan, we both have failed this exam, and today we are in front of you. So failing an exam, it doesn't make you inferior. Failing any exam doesn't make you a bad candidate. Failing any exam doesn't make you the kind of you can say the incompetent candidate. Maybe it was not your day. Maybe you have missed, 1 or 2 points. Maybe, you have missed something. Because I personally feel that each and every candidate who is going for this exam is equally competent. The difference what is going to make is approach. The difference what exactly is going to make in the result is your approach towards the exam, your behavior on the same day, okay, on that exam, and how you perceive your station, okay. And another one important thing, and then I will give mic to Dr. Hassan, that don't make scenarios in your head, okay. Whatever is given in front of you is your station. Don't make the stories in your head that okay, it is going to be like this because I have performed this station like this. No, whatever is given in front of you, that is your station, okay. So I hope it is going to make
Yeah, excellent.
some difference.
Yes,
Yeah.
definitely.
Yes, sir.
So I would like to thank all of you. I think this is the end of our session. We discussed mostly everything. Yes, Zong, you can open your mic, and I hope I said your name in a true way. Yong,
Yes.
not Zong. Yong.
So
Is
he's
it correct?
He's Jing Zhong.
Yeah.
Yes.
Hello.
So you can.
Hello.
Hello.
Hi. Hello.
Assalamu alaikum.
Walaikum
Alaikum
assalam.
assalam.
Sorry, can I talk with Dr. Hassan?
Yes,
Yes,
of
yes.
course.
Actually, I am Dr. Muawiyah. I did the exam in face-to-face with in Egypt last
Really? Yes.
last November.
Yes.
I am the one, Dr. Hassan, facing you.
Really? I examined you. Yes. Okay.
Yes, Dr. Muawiyah. Actually, I did all station like this with you, all station. I am sure 100%. I have never mistake even 1% in all the station.
Yes.
And unexpectedly, I failed. I got 61% out of 62%.
Oh my God.
Oh my God.
And I
Oh my
sent
God.
immediately. I sent email to Royal College. I am not understanding. I am not happy at all about this result. I don't know what is the problem.
Yes. Now, sometimes, even you are doing very well. I will give you a very simple example, and all of you, if anybody attended the exam on Monday, Oslo system, there were a station with a patient with a second trimesteric pregnancy loss due to abruption, and the patient was positive anti-cardiolipin or anti-lupus antibodies. So 95% of candidates pass through the management of antiphospholipid syndrome, which leads to abruption. Actually, the patient was cocaine addict. Okay. So what I would like to say is sometimes you may think you did well in the station, but you may miss the most important issue in the station, and because it's somehow hidden or you are not able to identify the point. But if you are really sure of your performance, and then I think you have to send a complaint and directly asking for remarking or something like this to the college. They will accept that. However, most of candidates, and this is the most important thing in this exam, most of candidates are ready. Most of candidates thought that they did well. Okay, no one will say I did too bad. Okay, except few candidates. Most of people are prepared, attended a lot of stations and courses, and have a lot of time to train, but they believe they did well, but actually, according to the marking sheet, they may not. Okay, and this has happened to all of us, by the way. After the results for me, for example, I failed 1%, exactly like you. And then I said, why? I'm expecting to pass 10 or 15% more than the pass mark. Maybe I could not achieve the idea of the exam or the station, but for 61%, I'm believing that there is no defect in knowledge, no defect in communication, or no defect in information gathering. I believe the only thing you have to stress more on in your next trial is patient safety. This is the only thing to guarantee the pass, easily pass. Because 61%, it's never because of knowledge. It's never because of communication. Somehow, maybe, but patient safety, most probably the core of your problem. That's why, but I believe if you are the same guy in my mind, I examined you first day in labor word prioritization, I give you straightforward pass. If you are the same guy, because of your voice,
I am the one.
You are the one.
Yes.
I just was talking about you.
Yes,
I am the one.
he literally praised about you that you did very well.
Exactly, you did very well. I gave you straightforward pass because you did very well from my point of view and my evaluation. So what I'm thinking in is maybe it's I have nothing to say. It's a bad luck. That's it.
It's okay.
Yeah, it's a bad luck.
Thank you.
Thank you. I'm sorry for what happened, but it's definitely a bad luck. Nothing more.
Thank you.
Yes. Yes.
Okay,
Thank you. Thank you.
Thank you so
Thank
much.
you.
Okay, Zijing, what you wanted to say? Zijing?
Hello, Assalamu alaikum. Dr. Hassan, can I ask one question, please?
Yes, you can ask me. Dr. Zeib are available. Yes, of course.
Yeah, because so you are an examiner, so I think you are the right person to answer me. Actually, I lost my connection for up to 5 minutes in my 6th station and for up to 3 minutes in my 5 stations. But I got just 3 reruns. So it was a technical fault. It was not a candidate's fault. So why did it rerun my whole exam?
No, it is a technical fault at your end. It has nothing to do with college, and college will only give rerun for 2 or maximum 3 stations, not more than that. They already tell you while they give you debrief in the beginning. Okay.
Yeah, but they also said that if the connection loss is significant, more than 3 minutes for more than 3 stations, then we may give opportunity the candidates to resit in the exam for the whole exam.
That is, I think.
Unfortunately, the decision regarding this point, my friend, is, shared decision between the college and the examiners who are evaluating you. So the college is coming back to me, for example, telling me the candidates lost connection for 2-3 minutes. Are you able to marking her properly or not. If the examiner said, yes, I was able to mark her successfully, yeah, that's okay. It will never be like a rerun station, okay? So I think most of examiners will say for this issue, yes, we are able to mark her. That's why they didn't offer you to repeat the exam again or to be kept from this trial or something like this. Because it's not only the responsibility of the college. We have your end internet connection, the system itself, and examiner's opinion. So this is the problem, most probably.
Okay, right. So, what you suggest? Should I mail the college or not? What are your instructions for me?
Okay,
I really appreciate.
my opinion is always the same. You will lose nothing if you send a complaint, as well as you will gain nothing after sending the complaint. let's be very frank, okay?
Okay.
They will never do anything to you, harmful thing, as well as they will never, correct anything. Because publishing the results, everything is fixed, revised with evidence, so nobody can claim them, okay? So
And
you
in
can send
Osler
whatever you
system,
want,
there
and
is not
but
only one examiner on one station. There are 2, 3 reserve examiners who are observing you. So don't just think that, only one examiner is giving you score, okay?
exactly,
So
yeah,
2, 3
exactly.
reserve examiners are also giving you scores. So that's why, it is a mutual decision.
Yes, this is
And
very, very.
sir, all 3 reruns they were with the lay examiner, but when I got the reruns, they were just single examiner. There was no lay examiner in that.
No,
So how would be?
he must be in, the hidden reserve examiner. They must be watching you virtually. Okay?
Most probably, yes. No, most probably, if the station is fashioned for a presence of lay examiner, so if in the rerun sometimes lay examiners may close the mic or being like an observer in the list, so they will not be apparent for you from your side of view. What I would like to say is to reassure you about this. Osler system is a very nice system, but it carries some problems as well. It's like any system. Somehow people may be very happy and lucky with Osler system that, for example, I had a scenario before that a candidate with multiple disconnections, and then all examiners are, afraid, they're afraid to give her a bad mark just because she did well in 3 or 4 minutes. I suppose she is fine, so she passed like this. And others may be not lucky enough, and multiple disconnections making too much burden and stress on them, as well as on examiners also. So the Osler system is a weapon with 2 blades. It could be nice, it could be not. That's why I'm always with, and I like more the face-to-face. If you have the opportunity to take face-to-face exam, don't be hesitated. Go directly for face-to-face. It's better for you to be more stable and confident to take all stations easily without disconnections. It's better to the examiner to evaluate more points properly rather than trying to somehow evaluate globally, okay, in Osler system. So this is my advice. Go for face-to-face. It's better option than Osler system because of all of these stuff, Rikita, okay?
So there is one question. Unfortunately, your advice came a bit late. Like we should not book exam for Feb. We have already booked exam for Feb. Now, please guide us how to keep us organized, systematic. What are the important things within this period of time to be focused specifically about Feb exam?
Yeah, Dr. Zaid, you would like to give a rapid advice to FAB exams, and then I will
Yes,
give
sir.
my advice. Yes.
Don't repeat mistakes, what you have done. I'm sure after giving one exam, everybody can analyze what are, the weaknesses in me. What were the area what I have not focused on? What were the things which I have not covered properly? So first of all, cover those points properly and revise your stuff. Okay, revise your guidelines and TOG articles, which are very much important to revise from, and then rehearse in the sense that don't I have come to know yesterday that one candidate, she is rehearsing 20 stations per day. Come on, that is also a torture to your neurons. Okay, don't do that. So please be gentle on yourself as well, be gentle on your neurons as well. If you will get tired in this the preparation phase, how you are going to face the real exam day? Okay, so prepare very well, don't repeat any mistakes, do try to rehearse like 4, 5, 6 stations properly from A to Z. A to Z mean that you are revising proper the guideline points, proper talk points, you are revising your patient information leaflet, you are speaking as well, you are recording yourself, you are analyzing yourself, and then of course if you are part of any course, so please do try to get the first hand what you can say guidance from your mentor. Okay, I'm sure every mentor is there to guide you, to support you, in all ways. So this is your job to seek help. If you are not going to ask any question, nobody is going to answer for any question there is. Okay, we are not in telepathy system. Okay, until unless the question is being raised, then only we can answer. Okay, so I think this is going to be a good approach, and don't just focus on simulated patient tasks, give equal attention to structured discussion task as well. So I think this can be done. Yes, walaikum salam.
How are you, Dr. Jabe?
I'm fine. How are you, Atya?
I'm good. Thank you for all the information. I just want to say that.
Okay, welcome. How precise. Thank you.
Thank you, Dr. Hassan.
How precise and how nice. Thank you so much.
Thank you, Adya. Thank you.
Yes, sir. Your valuable input.
Hello,
Yes.
I'm Dr. Bismil. I have one question. Whether I'm a bit wrong in that, it's my misconception. I appeared from UK with the UK candidates on day 1. Whether it is a comparison between their own trainees with the overseas.
No. Before you finish your station question, there is no big no. There is no comparison, sweetheart. There cannot be any comparison. This is exam, and exam is, same for you, same for them. Okay.
But what about they work in their own system? They know
so
the
what
thing.
you have learned through your experience. You have learned through your own, the guidance, isn't it? You are equally competent. Never think like this. Seriously, I really want to, kill this misconception in all candidates that, okay, if we are appearing with, me and Dr. Hassan, we have faced all face-to-face exam in UK. Okay. So for me, my day was day 1. And even on every day, we had, the local trainees as well. We managed to fail, we managed to pass as well. So there is no big deal. Okay. Never think like this. Trust me. Never think like this. There is no comparison. Okay.
Yeah, I agree. I agree with Zaid. Definitely. Okay, we are human beings. Okay, examiners are human beings, personal. So there will be always bias, always. But the system, the marking system, the observing examiner system, all of them are trying to minimize the bias as much as possible. Now, one of the most important things that examiners should be instructed for is you cannot build up your decision or opinion regarding the color, the nationality, the language, the working place for marking any candidate. So we are always oriented about these differences, and we are trying to bypass these problems as much as we can. So 99% there is no bias regarding this point particular. Okay, now regarding the FEP exam and people who are or will attend the FEP exam, number one, if you applied for this exam, so This is your own decision, and you are feeling that you are able to perform well. Nobody can tell you if you are able to perform, able to work until the day of exam rather than you. So, number one, if you feel that you are not able to appear again very shortly like this, don't apply for the exam. But if you feel that, yes, I can do it, go ahead. Now, people who are concerned about that, people who would like to appear again in the exam to overcome rapidly their shock because they failed in November. Now, those people are critically important to revise themselves. Now, I know this feeling very well. I failed the exam. I will go for the next exam rapidly to pass and to be happy and to celebrate. This is the only mission or the only thing in his mind. He will fail again. He will fail again. But people who choose to attend the exam because they were very near to the pass mark, 60%, 95, 59% or something, and they feel that they are just unlucky, but they covered and understanding everything, yes, go ahead without hesitation. This is for you, Sarah. Now, for people who will attend February exam, don't waste your time in revising the guidelines, the talks again, and all these stuff. Try to take a look on your feedback, which domains you could not achieve the standard in, and try to work on these domains. If you have a problems in communication, try to work more on communication. Try to read what the examiners are looking for in communication skills and try to fulfill it by training and so on. If you have a problem in patient safety, try to understand what are the points of patient safety that marking sheet is looking for. Okay, most probably the patient safety points are the medical legal aspects, blood transfusion, allergies, NTD, RH, pregnancy test in certain scenarios, and patient's dignity and following patient concerns. These are the points of, and of course, medications. You have to remember medications. What are the points? Medication side effects, contraindications, interactions, all of these things. This is the patient safety, simply. So try to work on your defect rather than try to globally work on the whole exam, because the time is too short. Yes, try to analyze your mistake and work on it rather than try to revise everything again, because the time is too short. Okay, so this is important. This is my advice. And again, my advice, I don't, for people who failed for 1 or 2 3%, you are not in need to go for more and more courses, listening to more people who will definitely disturb your mind. Definitely, because for myself, I have a technique. Zaid had a technique. Ozma has a technique. Okay, so if you followed multiple mentors with multiple techniques, you will be lost. So I think circuits, attending more and more circuits, will be very beneficial for improving your performance.
Exactly. Mocks. Give mocks, okay?
Yes,
Mocks,
exactly.
circuits. If you can face any face-to-face mock, I mean, which is very much important. Like for us, we are arranging as med exam in Pakistan, in Egypt as well with Dr. Hassan. So you guys are encouraged, take mocks. That is going to enhance, your communication and the way of performance in the exam as well. So you guys are always encouraged, okay? Even online mocks, they will do whichever you think you can, the feasible and you can take. So please do that, okay? Just analyze your shortcomings, analyze your own, the mistakes. By far, by giving 1 or 2 exam, everybody is in the position to understand the feel of exam, understand, how the exam is, what are the shortcomings. So, this is how it can be done, okay? For Karachi, I will arrange
Exactly.
especially for you, okay?
Yeah. Yes, yes. This is a perfect plan. Yes, I think so.
Yes.
So
Okay, guys.
thank you,
Any
everyone.
questions? Yes. Okay. Yeah. Yes, sir.
Thank you, everyone, for being with us. And again, it's not it's not like a condolences for people who didn't pass. Nothing like this.
No, no
It's
condolences at
just
all.
an encouragement session to all people that everyone passed through an experience of failure, either in part 2, part 3, in other exams as well. All of us had the same problem. In MD examination in Egypt, uh, they are asking you a question: how many times you attend the exam? Oh, sir, this is my first time. Okay, see you next time. Without asking you any question. Okay, this is the attitude. See you next time as well. So I think the college is very generous because people can pass from the first time. However,
Exactly.
sometimes you may be unlucky. Sometimes still the God willing is not like you have to pass. And sometimes you have defects. Work on defects, optimize your situation, and don't wait for anything. Success will come in the ideal time for you. Ideal time. And we will all celebrate together soon, inshallah.
Inshallah.
Hi,
Thank you.
Dr.
Thank
Hassan.
you.
Hello,
Yes, Dr. Anam.
mentors.
Yes, Hanam, how
Yeah,
are you?
yeah, I'm good. Thank you so much, mentors, for giving such a wonderful session to the people. And I would just like to say, on behalf of all the team, that we are, very sorry for those who couldn't make. We feel it at the back end. People don't know us, maybe, but each and every person in our team, we know our students out there. So we want to encourage them, and that was the total purpose of this session. And our mentors, Dr. Hassan, Dr. Zaib, Dr. Ismail, Dr. Pradnya, thank you all so much. You have very beautifully delivered that encouragement to the students, and we are very thankful. It was the essence of the session that we needed, and I must say that thank you so much. And also there is
Welcome.
one participant in the chat box. I don't know who is he, Dr. John, I
Regina.
guess, or DJ. Yeah,
Yes.
he
Regina.
wants to speak, I guess.
Okay.
Yeah,
Thank
so
you.
thank you.
Thank you for let me talk a little bit about my experience. So, firstly, uh, who is still on the? There's some background disturbance.
Yes,
Hello.
Young, I can hear you. Yes, you can hear you. Please,
Yes,
yeah,
please.
go on, please.
Thank you. So, firstly, thank you, Dr. Hassan and Dr. Ayib, for sharing your experience and help us mentally and physically, of course. And I would like to share something about the structured discussion I met on my day of November 14th. Because you mentioned that it's very important to read, but in my exam, I haven't finished reading about the prioritization of the gynecological list, and I try to keep on reading during the exam time, the 10 minutes, but the examiner is keeping pushing me to be quick to be quick. So it really affected my performance, I believe. And regarding the APS, and I got the mistake. I think this is a APS, but I asked about recreational drugs, and she mentioned about cocaine, and I said this could also cause placenta obstruction, but she said, "Do you mean it's me that caused the baby death?" I said, "Definitely not." And I asked sensitively, would you like to consider quit recreational drug? But she says no. So I want to know, how do we deal with such kind of situation?
Now, number one, what the examiner did in your station SD is, I can say it's wrong. Yeah, sometimes examiners are too much keen to help the candidates and to push them to save time, to direct them. Sometimes it's like this, but it's not allowed to push the candidate against his willing. If he would like to read more, if he would like to keep silent all the station, if he would like to not to read the station, this is completely right. So I think it should not be done like this by the examiner. This is a mistake, but I think also he or she did that for your sake, okay, for to help you. It's not a reason, but this is what I think. So of course this problem may lead to some stresses on you in your mind because you are not ready enough to start the discussion. But I think it's a very rare situation, very rare situation. It's not like this ever, okay? And regarding the station of APS, let me say something. I don't know, but I think I'm so evil because this station is refashioned and designed by me. I'm really sorry to say that. It's a very bad station, but one of the seniors in the Royal College, where they are putting the exam, they asked me to help him in, do a strange station. But this is my outcome of my brain, of my evil brain, unfortunately. This station, we are pushing the candidates towards the ABS strongly, and then the role player also is instructed to refuse the treatment and help to quit cocaine because she is in a denial status. She's in a denial status. She's not want to blame herself for killing her baby. So what the candidate should do is, number one, you have to just asking the questions of cocaine or something like this in between the questions in a hidden way. So the patient will, if the patient is focusing by her brain in cocaine as the major problem, she will refuse help and she will attack you controversially, okay? But the patient is instructed, if you offered her a help regarding cocaine, because cocaine is affecting her general health, not a main cause of abruption, she will listen to you, she will help you, okay, and accept what you are offering her, okay? So I think in this station, you did not approach the woman in a sensitive way, like what you say, because you showed her a direct link between the cocaine and abruption. Direct link. You have to show her in indirect way, okay? Indirect way, I need to help you for your general health because it will affect your brain, your nerves, and it may lead to your death, by the way. So we need to help you in that sake and keep away from the abruption itself. This is very important. Now, I'm telling you, in next exam, you may find the same scenario in front of you. So don't spend all your time to confirm if the patient is cocaine addict or not, because simply the marking sheet will be domestic violence. The patient was abused and she was kicked in her tummy, leads to abruption, and then you have to manage from another point of view. This is the new games by the college, okay? This is what I think will happen in next exams. They will take the same scenarios and just, change the marking sheet and change the scenario to be very similar to the original scenario, but with different management plan. I hope I answered you in a clear way or explained these points for my friends as well in the group. Zaid, do you have anything else to add?
No, sir, it was very precise. Thank you. It was very good.
Yes, because actually, yeah, I know that this station, if you are not experienced enough to give the information without criticizing the patient, because 100%, because she's a cocaine addict, she had abruption, she lost her baby, she is the a guilty one. But if the guilty sensation mentioned clearly, the patient will automatically attack you back. So she will refuse the treatment. She will refuse to believe that cocaine is the reason for losing her baby, and you will be in trouble. I suppose this is what happened in this scenario. But it was a very difficult station, very difficult day, by the way. Monday was very difficult day. I believe in that.
Dr. Hassan,
Yes.
Tension injury.
Sorry, I think the voice is interrupted. I'm sorry.
That postpartum tension which came on Monday.
Zaid, can you hear her?
No, I can't hear. I can't hear anything.
So
Yeah,
Atia,
because of this
you can write your question if you are not able to talk or you have some problems in connection. You can write your question. I will wait for you. Write your question, no problems. Thank you, Zong, so much, Young, for your valuable participation. I can understand your feeling, and I know how much was the station, either 1 or 2, was stressful for you. But let me tell you something important. English exams are not difficult. English exams are depending on multi-factor stresses. For example, the IELTS exam. If your English is fine, you will be able to pass easily, but they should put some stresses factors. The time factor is too short, so you need to rapid reading, hurry up to finish the station or the questions. So this is a sort of stresses. It's as same as in part 3 and in part 2. I'm always saying this fact. I'm always saying this. In part 2 examination, if I give you the exam, the same exam, and give you 24 hours to answer the exam, 90% of candidates will pass. Okay, 90% will pass. But if I give you 6 hours only to finish 200 questions, 40% will pass. They are playing always the game like this. So sometimes in part 3, you will find multiple stresses other than the scenario or the medical part of the exam. You have to cope with them, and you have to show professionalism dealing with the stresses situations to be able to pass. This is very important thing as well. So Tia, did you send your message?
Yes, sir, she did.
Yeah. What is the question? I didn't get it.
She's asking for that. There was a question on postpartum voiding dysfunction.
This
so
is
the answer
this is
was
my
pudendal nerve
station in
injury?
post voiding. This is my station in Monday. Yes.
Mhm,
This scenario, the patient passed through an instrumental traumatic delivery, and forceps delivery, and after that, she is unable to feel the bladder, as well as she is not able to pass urine. So she was opted for insertion of a catheter, and she's in the follow-up visit. Deal with her. Now, actually, this is a post-distension traumatic bladder injury. Okay, simply. So we have nothing to do rather than insert a catheter and wait for the nerves and the sensation to come back and to control this. Okay. And you can offer, for example, a clean self-intermittent catheterization. This is a good option. There is no rule here to offer urodynamics. There is no rule, okay? And in this scenario, it's not related to a pudendal nerve injury. It's a bladder concussion. Okay,
Exactly.
overall the nerve supply to the bladder is affected, and it will be regenerated. And then you have to offer the patient to say that um, you have to wait maximum to 3 months until the full function is coming back again. Now the problem is always in any discussion, candidates are missing this to discuss the risk factors of the problem with the patient. The patient at this point will keep saying why that's happened, why this happened to me. Is it a mistake? Is it a problem from the medical team staff? And then you have no answers to say, no, it is not, you will be fine. It's not like this. You have to explain to the patient what are the risk factors leads to this. An instrumental delivery is a risk factor. You have to ask if the patient had epidural or not. You have to ask about the baby weight. You have to ask many questions and offer her further appointment to re-evaluate her condition. You got my point. This station is not related to the knowledge. It's related how can you reassure a complicated patient. You got my point, Zaid. How can you
Yes, sir.
reassure
Yes.
her? Yes, okay. We are not looking for too much knowledge. So I will offer you a sacral nerve stimulation. I will offer you a surgery. No, I will involve a urogynecologist and urologist. I may ask for MSU or something like this. The patient would say, yes, I had twice. Okay, that's fine. And we will, just keep the catheter. If the catheter is annoying you, you can learn self-intermittent catheterization every 2-3 hours. This is the station. It's definitely a paramedical station, not a medical station. Okay. So this is regarding your question.
I was asking.
I
We
could
can't
not
hear
hear
you at
anything
all.
again.
Yes.
Yeah, we
We
cannot not
can't hear
hear
you
you.
at
I'm
all.
sorry.
Yes.
I'm really sorry.
Hello?
Yes. Now it's perfect.
Okay. If the patient asks when you will be removing this catheter, what should be the answer? The
I'm
3 months?
really sorry. Yeah, I'm really sorry because the functions of the bladder, when it would come back again, nobody knows. We are expecting that maximally within 3 months, maybe less. But we have no answer like this. So we will wait. You will be supported by the whole team. And
Agreed.
we will keep following you until the bladder function is fully regained. This is the answer. This is the truth.
Okay.
Nobody knows. No,
Yes.
in the real life, nobody knows. Okay, so this is the truth, actually. Yeah, simply,
Yes.
it's all
Okay.
about reassuring the patient, and don't incriminate your team. It's all about this.
Okay. Thank you. Thank you.
Thank you, my friend. Thank you,
Okay.
Adil.
Thank you. Okay.
Thank
That's
you,
very good.
everyone. Thank you. I'm really happy, and it was a very interesting session, especially after Zaid's coming and joining us. It was more interesting. And thank you for the mid-exam backend team for preparing this session. It's a magnificent session. And always, if anyone have any problems, any queries, don't hesitate to contact mid-exam team,
Yes.
Zaid, Ozma, Bradnia, and me. We will be very happy to, share our limited experience and to help all our friends. Thank you so much, my friends.
Yes. Yes. Thank you so much, everyone. All the very best. All the very best. Give your 100%, and that's it.
The last question for Young, he is asking, shall we report to police without her consent? No, you should not involve police at any station in part 3, except FGM, acute or recent event. Otherwise, you will contact social services and risk management team to help the patient. Okay, and I prefer also if you have a problem with a confidentiality or to keep confidentiality issues, if you have any queries in your mind, don't put yourself in a difficult situation. I would like to involve the confidentiality guardian. He will help you more, the Caldecott guardian. Don't take the responsibility of any issue alone. this is this is very easy. This is very easy.
Exactly.
Because of course, Nooni, she will say no. If you tell her, I will inform the police, she will skip away from the beating. She will leave the exam and run away home. So don't do that. Okay? You have to be you are not a judge, you are a doctor. So you have to be a good human being, okay? And to feel patients' problems rather than try to judge them. Okay? Excellent. That's great. That's great. Okay. See all of you soon in a session to congratulate successful candidates.
Yes,
Inshallah, very soon.
definitely, inshallah. Thank you so much, guys. Give your 100%, okay? And don't be upset, don't lose hope, and don't just sit that and wait for miracles. Miracles are not going to happen. You have to work hard to earn, any kind of success. All right? So all the very best. We are always here to help you, to support you. If anybody has any kind of question, can always reach out to us, okay? All the very best.
Bye-bye.
Bye-bye. Thank you.